Hey, I just saw the patient in room 1. Can I tell you about her?
Sure.
So she's been eating and drinking fine. Her older sister is 2 years old and was just diagnosed with RSV. On physical exam, she's afebrile, heart rate is 130, blood pressure is 100/70, but she did start crying when the cuff went off. Her respiratory rate is 50 breaths per minute. She looks well with some subcostal retractions, but is pink and well perfused. Her lungs are coarse, lots of stertor, but no crackles that I could appreciate. Regular rate and rhythm. Capillary refill is less than 2 seconds, and her pulses are strong. Belly is soft, and she has appropriate tone. Her fontanelle is also flat. So my assessment is this is a full-term 6-day-old female with fever, cough, and congestion that's consistent with RSV, especially with her sister just being diagnosed. Since she looks so well, I think that we can test her for RSV and send her home.
So we definitely can't send her home. This is a neonate with a fever, and so we need to be worried about invasive bacterial and viral infections. She needs a more extensive workup like CBC, CMP, CRP, or procalcitonin, and we should start her on antibiotics. So what antibiotics do you want to start?
Ampicillin and ceftazidime.
Yeah, those are great choices. What about acyclovir? Does she need that?
I don't think so. I did ask Mom about history of STIs, including HSV and any suspicious lesions, and she said no.
Okay, that sounds good. I'll go examine the patient and update the family. Why don't you go get the things for the lumbar puncture so we can get it done quickly?
Okay. Hey, I just saw the patient in room 1. Can I tell you about her?
Yeah.
Okay, so this is a 6-day-old female with fever, cough, and congestion. Mom says she's been sick for the last 2 days with nasal congestion and coughing, but just had a fever to 101 degrees Fahrenheit, which is why she brought her in. She's been eating and drinking fine. Her older sister, who's 2 years old, just was diagnosed with RSV. On physical exam, she's afebrile, heart rate of 130, blood pressure of 100/70, but she started crying when the cuff went off. Respiratory rate of 50 times per minute. She looks well, some subcostal retractions, but it is pink and well perfused. Lungs are coarse, lots of stertor, but no crackles that I could appreciate. She has regular rate and rhythm. Cap refill is less than 2 seconds, and her pulses are strong. She also has a soft belly and has appropriate tone, and her fontanelle is flat. So for my assessment for this patient, this is a 6-day-old female with cough and congestion and fever that's consistent with RSV, especially since her sister was just diagnosed. Since she looks so well, I think we can test her for RSV and send her home.
You're absolutely right that we need to consider invasive bacterial and viral infections. In babies 21 days and younger, we need to rule those out, and we need to be especially careful in babies under 7 days old. The AAP actually just recently released some new guidelines for the management of febrile neonates. In her, since she's under 7 days old, we need to rule out all possible bacterial and viral infections. So knowing that, what would you like to do?
I suppose we should get a CBC, procalcitonin, a urinalysis, and start her on antibiotics. She should probably also get a lumbar puncture.
Yeah, I think you're absolutely right. We need to admit her and work her up for meningitis just to be on the safe side. So why don't you go get the supplies for the lumbar puncture? I'll go examine her and talk to the parents and give them an update.
Okay,
Okay.
sounds good.